Good afternoon. I'm Raina McIntyre on behalf of OzSAGE. I'd like to acknowledge the Ku-ring-gai people of the Gadigal Nation, which is where I'm speaking from, and pay my respects to elders past and present and any Aboriginal people here today. Just going to share my slides. So OzSAGE is advising against removing all preventive measures against COVID. And I use the term preventive measures rather than restrictions, because I think there's been a conflation of lockdown with really valuable public health measures that are for prevention of disease, rather than being restrictions, measures that do not impinge on your freedom or your ability to do the things you want to do. I'll start off with the statistics. There have been 324,806 cases in the past 2 weeks. 53% are below the age of 30, 645 active aged care outbreaks, over 2,000 new cases and 166 deaths in aged care in the last 2 weeks. And there's the epidemic curve, which you can see is going down, and the age distribution in the top right-hand corner, showing the bulk of the cases in the under 19-year-olds. Here's the data on vaccination. 76% of Australians have had at least one dose, and 42% have received the booster dose, the third dose. That is not as high as you'd want it to be. You'd want that to be, close to 80%, because 2 doses barely protects against symptomatic Omicron infection. Here's the data on hospitalizations and deaths. We've had 684 deaths in the last 2 weeks, and that's the sorry, was I on mute all that time? Okay, let me go back.
No.
Oh, I wasn't? Was I on mute at the beginning?
No, we could hear you.
Okay, great.
I could hear it till the
Only a few seconds, Raina.
Got accidentally muted. Okay, so this is the graphs of hospitalizations and death. On the left-hand side is hospitalization fatality rate and the trend over time from September to February. And you can see that it's going up. We know the deaths lag behind the hospitalizations and cases quite substantially. And then on the right, you can see the table showing hospitalized, ICU and deaths by state. The greatest number of hospitalizations in New South Wales and ICU, 77, people on a ventilator, 35, followed by Queensland and then Victoria, with a total of over 2,000 people hospitalized, 184 in ICU and 70 people on a ventilator. And again, that epidemic curve of the hospitalizations, ICU and ventilation. The ventilation is the dark red and the ICU is the orange, and the blue is the hospitalization total. You can see that there was that peak towards the end of January and then a decline. There's no formal national reporting of COVID in schools, but we've heard that there have been about 10,000 cases in Victorian schools in the last week and about 20,000 cases in New South Wales schools in the last week. We've also heard, unfortunately, that rat testing, which was twice a week in New South Wales, is going to be scaled down, and parents are going to be given 8 rat tests, presumably forever. I'm not sure what time period that will cover, and kind of manage their own risk. And at the same time, we've seen very troubling trends in the UK, where I believe parents now, the free rat testing has ceased there, and parents can send their kids to school if they're infected. So we advise against removing all preventive measures, because preventive measures, which are good public health measures, to prevent disease have been conflated with lockdown. It's like everyone's, you know, tired of the pandemic, that, you know, lockdown was terrible. And so everything else that went along with it is put in the same basket and rejected. But it's very clear all over the world that vaccines alone are not enough. The Omicron wave that we saw in Australia could have been better mitigated if we'd addressed ventilation and had a vaccine plus strategy, which includes the use of masks and testing and tracing. We know the testing system collapsed in December, and that it's been very restricted access to testing since then. And as I mentioned, vaccination rates for adults are still low for the third dose, and children remain essentially incompletely vaccinated because vaccination was only started in January with an 8-week interval. And we know that there's multiple school outbreaks being reported. We also know from overseas data that the risk of reinfection is quite high, especially for people who've only had 2 doses. And we've seen reinfection surging in the UK, for example, during the Omicron wave. In Australia, we've had substantial health systems, economic and societal impacts of Omicron. That includes for example, in New South Wales, in the most profitable period for the hospitality industry over New Year, a lot of cancellations and people not wanting to go out because the wave was at its peak. So instead of the freedom and economic prosperity that was promised, we saw those kind of cancellations, and we saw supply chains disrupted because so many people were sick that they couldn't actually go to work to pack the shelves, unpack the shelves, load the trucks and drive the trucks. So we had shortages of things like chicken and other basic grocery supplies in the supermarkets. And it's just astounding that none of that was anticipated. That, you know, on the one hand, a decision to let infection just occur without any mitigation, and on the other hand, not planning for adequate testing and not planning for massive absenteeism from work. We are also deeply concerned about the New South Wales Parliament lower house voting to remove access to workers' compensation for people who become infected at work, unless they can prove it was contracted at work, which is obviously going to be incredibly difficult because they can just turn around and say, well, you caught it on the bus or you caught it at the supermarket. It's now with the upper house, and we urge the government to reconsider this and not to make access to workers' compensation difficult. It's particularly harmful for essential workers like teachers and health workers who have to go to work with this threat of reduced work health and safety protections if they get seriously ill or disabled from COVID, while simultaneously having to face really high levels of infection because of the removal of preventive measures to reduce transmission. So it's a double whammy for our essential workers. We really urge that making access to workers' compensation more difficult is unjust and removes any onus on employers to provide safe working conditions and safe indoor air. We also are concerned about the fact that a lot of people are going to be left behind under this strategy. There is now very much a mainstream message of ableism and minimization of people who don't fit into the healthy, normal stereotype. But over 50% of Australians have a chronic disease of some kind. 1 in 5 Australians has a disability. We know the Aboriginal and Torres Strait Islander population is under-vaccinated compared to others. The rate of 3rd dose vaccination is lower in aged care and disability care. So removal of COVID prevention measures and high levels of transmission is likely to be much more detrimental, to be fatal, or cause severe complications in these populations, which accounts for a large proportion of people. So our recommendations then, to finish off, are number 1, to retain the indoor mask mandates and recommend high quality respirators. Now, this is really important. There's been a new study that's just come out in the journal Cell, which is linked in the media release, and you can click on that link and read the study. But in that study, about 37% of people had long-term effects beyond a month after having COVID. And they also had serious neurological side effects and ongoing problems with cognition. They also showed, most importantly, that the risk of developing long COVID is related to the dose, the viral load and the dose of exposure. So if you're wearing a mask, even if you get infected, your dose of exposure is going to be less. So it's possible that it will, on first principles, it will also reduce your risk of getting long COVID. We know that vaccination reduces your risk of long COVID. And there's also a lot of other long-term complications of COVID for which there is an abundance of research evidence now in the peer-reviewed literature, including a series of studies that show a paper that came out in Nature just a week ago, which showed pretty much double the risk within 1 year, within the 1 year period after recovering from the acute illness, double the risk of a heart attack, a stroke, heart failure, and blood clots. So that's not the flu or a common cold. That's a really serious outcome that unfortunately we've seen COVID outcomes reduced to a binary of dead or alive. Well, you didn't die, okay, you're fine. Well, you're not necessarily fine, because we know that there are serious outcomes beyond the acute illness. There's also a range of studies that have come out showing quite serious neurological damage. You know, one study showing CT scans of the brain showing shrinkage of the brain, another study showing changes consistent with Alzheimer's disease or similar to Alzheimer's disease in the brain of people who've had COVID, and another study from the US National Institute of Health showing persistence of the virus in the brain and in pretty much every other body organ long after the acute infection is over. So this is not a virus that you just clear and get over and done with. We're also seeing a lot of reinfection where, you know, the WHO says that countries should scale up testing and tracing and should invest in good surveillance and should mitigate transmission, because the more transmission there is, the more risk of more variants emerging, and there will no doubt be other variants. So we also recommend initiating widespread education on wearing better quality masks and respirators that fit well. We think, you know, it would be good to provide free RATs, rapid antigen tests, as some other countries are doing, and to really invest in expanding and strengthening our PCR testing capacity, as well as tracing and the TTQI, the tracing, isolation and quarantine, and make sure that we expand the surveillance for emerging variants. At the moment, you know, the PCR testing has been restricted rather than expanded, and rapid antigen tests are still expensive and difficult to get and unaffordable for a lot of people. We think it's really important to retain the QR codes, because the QR codes are what allow you to do automatic digital contact tracing when case numbers are too high. And I think it'd be good to actually poll the public and ask people, do you want to know if you've been a contact? I don't think the decision to remove QR codes has been justified or explained. And I think it'll be good to find out what people actually want in terms of knowing whether they've been a contact. Really important, as we made clear in our previous press conference, to maintain accurate reporting of cases, hospitalizations and deaths. And we've made some recommendations on that, which you can see in our paper on monitoring deaths. We recommend maintaining existing access to workers' compensation for people infected at work. It is just essential, especially for frontline workers like teachers, healthcare workers, paramedics, police, people who have to have a lot of personal contact with other people in the line of their jobs. and be in high-risk settings, aged care workers as well. I think it's important that we get the message out to people that in a positive way, because there is still a lot of hope for development of new drugs and vaccines, that the pandemic isn't over, but that we can do better to keep it under control and enjoy life more normally if we use other public health measures like ventilation and vaccines plus, especially masks, and that if people have that knowledge, then they can empower themselves to protect themselves and their loved ones, which is good for our society, it's good for our economy, and it's important not to give people a false expectation that it's all over. Sorry. We recommend mandating and regulating safe indoor air in workplaces and public indoor spaces, especially schools and childcare centres. We commend Victoria for having addressed that in schools, and other jurisdictions should follow. We've got more detailed guidance on that. And we think that it's really important that state and federal governments develop and release plans for the management of future variants of concern. Because currently the message is it's all over, there's nothing more to worry about, and we've done all we're going to do for you. We need to urgently increase third dose vaccination rates and plan now for the logistics required to vaccinate kids under 5 when that becomes approved. And that's the end of our recommendations. So happy to move to questions. And there was a lot more detail in our in the document we sent out. So feel free to ask questions based on the document. You can type your questions into the chat, or yeah, I think that's the only way to ask questions. Type them into the chat. I think it's worth mentioning too that we saw some statistics about the people who died from COVID, and it's clearly people who are from socioeconomically disadvantaged populations, particularly people born overseas in particular countries. We know that the ability to survive COVID with minimal complications is related to resources and means, you know, as well as the ability to prevent others in your household getting infected. You know, if you've got a holiday house that you can escape to, or, you know, a 7-bedroom mansion that you can isolate in conveniently compared to living in a small apartment with a large family, it's going to be much harder. So I think we need to take on board the socioeconomic disparities that we now have clear data on for Australia, but have also been seen all over the world. Question from Professor Lisa Jackson Pulver: if there was one intervention only, what would it be? I think you mean other than vaccines, Lisa, because I still think vaccines are a pillar of the response. I think it is face masks, to be honest, but you know, the problem with COVID is you do need the multi-layered approach. There is no one intervention that's enough on its own. You know, you need the testing and tracing, you need the masks. The testing and tracing are really important. They're sort of cornerstones. Professor Karen Phelps, would you comment on the use of the term endemic in the context of abandoning safeguards? Well, you know, endemic is actually a technical term, and epidemic is also a technical term. Epidemic diseases are defined by their reproductive number R0, and SARS-CoV-2 is clearly an epidemic infection, which means it's going to behave more like measles than malaria. So malaria is an endemic infection. You can have very high levels, but it stays at constant levels. It doesn't change rapidly. Epidemic infections can change very rapidly over short periods of time. And it's that tendency that causes the collapse of health systems, right? You go from 0 to 100 really quickly. All of a sudden your hospitals are overwhelmed, your ambulances are ramped, etc. That's the nature of epidemic diseases. So we still see that pattern with measles. It causes epidemics. And I think that's the pattern we'll continue to see with SARS-CoV-2. It is the pattern we've seen with SARS-CoV-2. Go and look at our world in data and the graph for SARS-CoV-2 in the world, and you'll see waves, 4 big waves since 2020. And that's the pattern we'll continue to see. There will be other waves that come. It's not going to just putter along at a level that we want it to. So I don't think it's going to be endemic ever. It's always going to be an epidemic infection. Which means we need the ventilation and vaccine plus strategy. It's actually so straightforward. We know what we need to do. If we could invest in those things and just maintain that level of other mitigations, we can actually live much more comfortably and safely than just set and forget with 3 doses of vaccine. Dr. Karina Powers, if you care for a disabled person and you go shopping, you want to know if an infected person has been in the shop at the same time, and you may wish to put in extra precautions and other examples of how QR codes are useful. Yeah, exactly. People have different circumstances and different personal needs, and some people won't care and don't want to know, but a lot of people I think would want to know. But we don't actually know what the actual community thinks. Professor Lisa Jackson-Pulver, also the waning of boosters, how often should there be, extra boosters? The last bit was, we don't know yet. Israel obviously has gone ahead with a 4th dose for people over 60 initially, and I think they might have expanded it after that. Other countries are still struggling to get the 3rd dose rate up. I think the first priority should be, let's get the 3rd dose rate right up. We know that the 3rd dose starts to wane as well after about 3 months. Protein boosters, another question, not approved in Australia yet. So the Novavax is approved, but not as a booster. But I think over time we'll see more and more options and more choices that are available. Okay, so if there's no other questions, here's another question from Bill Boutel. How concerned must we be about the falling away on 3rd doses? What can be done to improve this? Well, we should be concerned. It's clear, the data is there. Those vaccines wane, the 3rd dose wanes. So the peak of 1st dose vaccination particularly in New South Wales with the Delta wave would have been around August last year. So those people may have got their 2nd doses, October, perhaps around October, and then they might have got their 3rd doses around January or later, which means by April, May, we should be seeing on a population level the effect of that waning. We'll see that will contribute to another rise in cases, another wave, which is potentially preventable if we use all the other mitigation strategies that we can use. Professor Phelps, with waning immunity and emergence of new COVID variants, doesn't that make these safeguards all the more important? The plus in the vaccines plus. Yes, absolutely. Advice about the flu shot. Yes, definitely get your flu vaccines. They've always been important. It's certainly been documented you can get flu and COVID together. And, if you can prevent an infection, it's worth preventing. Okay, so I think that's probably the end of the questions. So thank you very much. This will be up on the website. The document will be uploaded onto the website later this afternoon, and the video as well as soon as it's available. So thank you very much and stay safe.
Fabulous.